Do you think that the epidemiology, I can't remember the number, but it's like 2 or 3 per 100,000. Do you think the numbers are undercounted?
Oh, yeah. I mean, 2 to 15% of people with IIH and pregnancy are going to have an issue. Like 15% are going to need some type of treatment. That's a lot of people. I think that it's definitely underdiagnosed. I think a lot of people probably have mild IIH and they just have been dealing with it and don't know it, because if you don't really complain about things a lot, and if it's your norm, it's sort of like it's normal for me. Like I ask a patient, like, "Hey, are you having any headaches?" Not any more abnormal than I usually have. I'm like, well, tell me what you usually have, and because people are used to just grinning and bearing it and going on. So I would definitely encourage patients, if you have a headache more than about once every couple of weeks is not normal. It's just not. Like, you should not be living your life with headaches. Like, I get a headache maybe every month. I get a headache because I'm tired or I'm sick. But people with IIH are getting headaches a couple times a week. That's not normal. So I think that it's definitely underdiagnosed because it's a woman's disease. And women honestly don't complain as much as men. I hate to say it, Barack, but we don't complain as much. And because we don't complain as much, we sort of grin and bear it. It's like, oh, it's normal for us. So yeah, I do think it's underdiagnosed for sure.